Good morning, everybody. It's Tracy, and welcome to another episode of What Has Changed Your Life. Today, we are going to talk about, first of all, we're in a different location today, and so I don't have my tripod, so I'm looking a little bit down here, but that's okay. Today, we are going to talk about cancer and my cancer journey, so it's just me today. You just got me today. So we're going to talk about my journey and where I started, where I ended up, and where you go from post-treatment and post-surgeries and post-radiation and all those things. So if you have any questions for me, or any questions you have about any of your loved ones, put them in the chat and let's talk about it. So my journey began in 2001, November 25th, 2011. You know why I said 2001? Because my kids were born in 2001. Good morning, Robert. My kids were born in 2000. No, my journey was November 25th, 2011. And I found out I had breast cancer. So how I found it was through self-breast exams. And I discovered a lump, a thickening in the breast. It was in the right side. And this is, my right, your left. So I felt it, and I immediately went to my family physician. So it was interesting because nobody else could feel it but me. And so I was very insistent that this is something that needed to be looked at. So we got a mammogram, and in the mammogram it showed something. But then even still, I was only 39, so people were like, oh, it's probably an adenoid fibroma or something like that, which is just a benign mass. So I had a biopsy done. I had an ultrasound guided biopsy where they put local into the breast, and they put a needle in, and they take specimens from the actual mass. So I had that done, and then came back 2 weeks later, and that's usually roughly how long pathology takes. I went to the local breast assessment center, which we have at South Lake. We're very fortunate enough to have that there. So all my things were done in the same place. And the pathology came back that it was HER2, well, actually it was breast cancer, invasive ductal carcinoma. Turned out the markers were HER2 positive, which is a specific type of breast cancer. So there's a couple of types of breast cancer. Breast cancer can be driven by estrogen, progesterone, HER2, or be triple negative, which means that these three markers, the estrogen, progesterone, and HER2, aren't showing up in your pathology. So those are the different types of breast cancers. And so mine was HER2 positive. So it was driven by this HER2 that basically makes the cells divide and grow. So in that discussion with my surgeon, we talked about different options. So some of the different options you have with breast cancer are lumpectomy with what they call a sentinel lymph node biopsy. So they take the lump out and the margins around the lump, and then they go into your armpit and they take out the lymph nodes that are affected. And they put different medications in there the day of surgery that basically make that area more radioactive so that it gets hot. We call it hot. It's hot, and then we remove those lymph nodes, and then those get sent to pathology to see whether or not the cancer has left the breast, gone to the lymph nodes, and is possibly traveling around your body. For me, my lymph nodes were negative, and I had 4 lymph nodes taken out of my right armpit, and I chose to actually have both of my breasts removed. Chop, chop, gone. So in doing that, I was lucky enough, and probably one of the first people at my hospital to have this procedure done, where I had the mastectomies done, and then I had reconstruction at the same time. So I used, the surgeon used implants specifically designed for breast cancer. And so when they remove the breast, it goes basically almost to your chest wall. So you need an implant that's flat on the back that lays against your chest wall. And then it kind of comes out like this to give you that shape of a breast. But the one thing you need to do is you need to make it so the implant is secure. So it doesn't move around in the mastectomy pocket. So what they do is they take this inert sheet of dermis, which they call alloderm. It's inert because they've done chemicals in it. It's not going to react to the body. And it looks like a sheet like this. And what they do is they cut your pec muscle in half. So on this side of your pec muscle, they put the breast implant under there a little bit. They take the alloderm, they sew it on the bottom pec muscle, flip it up like a hammock, and then sew the top and all around so that it stays in that mastectomy pocket and doesn't room. So I like it to a hammock. It's like a little hammock for the breast implant in there. Mine are not ones that are, because I know there's a big thing on right now about implants causing leukemia or different types of cancers. And I've checked with my surgeon and mine are not those types. So that is good. I don't have to worry about that. But so that is what I chose to do. Now, some people are like, wow, that's pretty drastic to remove both your breasts and, are not comfortable with that decision. So for me, I'll give you a little information. There's breast cancer, a huge amount of breast cancer in my family history. I'm adopted. So on my birth mother's side, she had breast cancer. I'm pretty sure her mother had breast cancer, but her mother's brother, all his kids had breast cancer. All the daughters had breast cancer. So there's a huge amount of genetic component for me in there. So for me, that decision of removing both the breasts was a no-brainer because I wanted to make sure that I slept at night. I wanted to be able to go to sleep for the rest of my days, however long and short they are, and not have to constantly be worrying, are they going to come back? Is breast cancer going to come back? So for me, that made the most sense. And also, I mean, do they 100% take all your breast tissue when they do mastectomies? No. There is I think it's 1 to 5% of fat still left there because obviously they can't take it all. And so hence, then you have chemotherapy. So for me, I was 39 years old when I was diagnosed with breast cancer. So I knew they were going to throw the book at me because they wanted to make sure I had the best chance of survival. So I was offered chemotherapy. I did not require radiation because the tumor was actually far enough away from my chest wall that they didn't need to radiate the chest wall. And that's one of the reasons why sometimes people are not given the option of reconstruction after a mastectomy right at the same time as surgery. I think I forgot to clarify that. I actually had reconstruction at the same time as my bilateral mastectomies. So that was luck on my part. That isn't always an option for people because if their tumor is too close to the chest wall, they'll need to radiate. And so you can't have an implant in the way of that. So that's why you can't have it. And then you can talk about with your surgeon about options for later after radiation and everything is done. So I had to wait a few weeks before I could see my oncologist. And then, so my surgery date was December 12th, 2011. And I saw my oncologist. I met them in January. And then they laid out the regime for me. So I needed 6 rounds of chemo. My first 3 rounds were 3 drugs. My last 3 rounds were 2 drugs. So my first chemotherapy was in February 6, 2012. And you're thinking, man, I can't remember lunch. How do you remember those dates? They're significant in your mind because they are dates you will never forget. I remember sitting there in the chemo chair my first day thinking to myself, this can't be happening. Like somebody is going to come and say to me, this is all a dream. We're sorry, we made a mistake. You can go home. That did not happen. They were like, and the funny thing was, I'm sitting in the chemo chair, right? I'm sitting there. They're getting me all hooked up to the IV, started an IV, whole 9 yards. And I'm sitting there, and the nurse comes along with these 3 drugs I'm supposed to, take. She's got the plastic gown on, 2 layers of gloves. She's got a shield, a mask, and I'm looking at her and I'm like, you're wearing all of that. What about me? This is going in my body. This is crazy, right? So that was my first day of chemo, and I remember just totally, like, I could barely concentrate on what people were saying to me on that first day of chemo because it was like noise in my head, and I just wanted to scream. And I was thinking, I just want to get out of here. I want to scream. This can't be happening. This can't be real. And it was. And it was, I want to say, like, I'm going to backtrack a little bit, but I want to say when I was diagnosed with cancer, that I was like, brave. I'm going to, do the fight. I bawled like a baby. That first weekend, they told me on a Friday, and that first weekend, I was a mess. I couldn't even sleep with the lights off. The lights had to stay on. I was so terrified of what my mortality was going to be. My kids were only 10 at the time. Was I, going to die from this? Because you didn't know at the time. You didn't know. So your mortality hits you like right in the face. And so that was my first experience and with chemo and cancer and just the whole journey. So I literally sat in that chemo chair wanting to scream my head off, like, this cannot be happening to me at 39 years old. Like, holy shit, right? You got your whole life ahead of you. You think you think you're invincible almost, and it's too young to happen to me, but it wasn't. And then, you can go into the why me scenario, but then you think, well, why not me, right? If it's going to be somebody, it's I'm no different than anyone else. So why wouldn't it happen to me? So the first chemo treatment, they give you a whole bunch of medications you take before your chemo treatment. And so that's to help you with nausea, symptom management, those types of things. Prednisone, ondansetron, those are fancy names for drugs, steroids, and anti-nausea medications. And just to prep you up. So 3 days before, you take these other medications to prep you up for chemotherapy for that day. And then anti-nausea didn't work a thing for me. Didn't even touch it. I was sicker than a dog. It started happening about 3 hours after my first chemotherapy treatment. I started feeling unwell. And I phoned the pharmacist. I'm like, I've taken all these drugs. Why am I feeling sick? And they were like, well, that happens. So needless to say, I was very ill for the first 24 hours. I would literally, the vomit was so violent. I could have probably vomited across the room. I know you probably don't want to hear that, but that's the reality of it for me. I could have vomited across the room. And so it was very awful. And one of the things that when I went back to see my doctor, I said to her, that was like unbelievable. There has to be a better way. And she said to me, we can give you IV fluids. So that's one thing I always say to people if they're going through the journey is there are ways to figure out how to manage your symptoms while you're going through chemotherapy and radiation and all of these things. Don't hesitate to ask. Advocate for yourself. Ask what it is that you are, like, say to them, this is the problem I'm having. How do we manage this? And don't be afraid, because they can't read your mind and they can't tell what each person, because I know somebody else that was going through the same similar treatments that I was at the time, and they got fatigue and things like that, but they didn't get the violence of sickness that I had. So two people, similar diagnosis, different paths. So it's very important when you're going through anything, or a family member is going through anything like that, that you basically speak about your symptoms. And I forgot to say, I think I did say good morning to Robert, but I'm just going to put him up and say, hello, Robert. If you guys have any questions or any comments, put it on there. Let me see who's there, who's watching this morning. So I had 6 rounds, like I said, of chemotherapy. So my first 3 drugs were not doxycycline. It was cyclophosphamide, 5-FU, and what was my third one? Not doxycycline. Doxycycline and Herceptin were the last 2. I'll remember the third one. See, I still have chemo brain. I can't remember the third drug. It'll come to me. So part of the reason I had to break up the different drugs was because some of the chemotherapy drugs are what they call cardiotoxic. So what that means is they can hurt your heart. They're damaging to the heart. So you have to get echocardiograms done as you're going through chemo treatments to make sure that your heart is not being affected. And I was lucky because the drugs did not affect my heart very much at all. And in fact, my heart barely moved when it came to what the parameters they use. And so I was lucky that way. But this is a very important thing to do as you're going through these treatments. So they don't want to put too many cardiotoxic drugs together. So they separate them. So one goes here and one goes to the second half. So that's what happened with me. And also in the second 3, I started a drug called Herceptin. So if you remember, I was saying that mine is HER2 positive. And so Herceptin is a specific drug that works on the receptor HER2. And what it does is it blocks the signals to the cells to rapidly divide and growth. So that's what layman's terms, what Herceptin does on the HER2 receptor. Now, chemotherapy, what it does, it's a systemic thing. So it goes into your veins and it goes through your whole. So systemic means whole body, goes through your whole body. And what it does is it attacks the rapidly growing cells. So it says, those look like cancer cells, so we're going to attack those and we're going to kill them. And that's how it works. Because we don't know, like nobody knows if those cells, even though my lymph nodes came back negative, there could be microinvasion that they can't see with the microscope. So you've got to get rid of them. So that's where the chemotherapy comes in. Good morning, Nita. How are you? I hope you're doing well. And so that's what the chemotherapy does. And the radiation, what it does is if you have a lumpectomy, you more than likely will have radiation. And it's a beam basically putting in a certain amount of grays onto the area where the tumor is in a surrounding tissue. Or if you're having it after your surgery, it's around where you had your surgery, and then it basically radiates those areas with the same idea of killing the cancer cells and making sure that they don't go anywhere else. So those are some of the different options that you have that would be presented to you if you were a cancer patient or your loved ones are a cancer patient. Each person's treatment regime is different in the fact that it's tailored towards you. And so there's a tumor boards that they have at the hospital. And so when a case comes up, they look at it, they look all the pathology, they look at the age, they look at everything about the person, morbidities and things like that, to see what treatment would be best for them and what would give them the best chance of cure. Now, sometimes, as we know, there are cancers out there that we cannot treat, and the outcome is not as positive as mine. And those are all looked at. And then those become, how do we make that person comfortable as they transition into the palliative phase of life and then into end of life? Because palliative and end of life are very different. In terms of palliative, it's keeping them comfortable. End of life, obviously, is end of life. And so those are different things that they look at when they're looking at a person. So they take your whole picture into account when they do go to these tumor boards, and they discuss, okay, what would work best for this person? And that's why sometimes when you hear women, they talk about different medications that they had for chemotherapy. And, some had surgery, some didn't, some had chemo before surgery. It depends on every individual person, what happens to them in terms of their journey. So I finished my chemotherapy May 31st, 2012. And good morning, Caroline. Nice to see you today. Happy Sunday, everyone. So yeah, I finished May 31st, 2012. And I continued taking Herceptin. Is something you have to take for a year. So one of the things that I had in just before my second round of treatment was I had to have a portacath put in. And basically because of the Herceptin, they didn't want to have to look for a vein every single time I went to the cancer center. So what they did was they put a portacath in. It's just a little thing that connects underneath your skin into your veins there. And so each time they would just access the port by putting in the needle into that port. And so it made it comfortable for me. I just put a little antiseptic on top, a little bit of cream. You can get it, it's called Emla cream. You can get it at Shoppers Drug Mart. You put it on an hour before, and that way it doesn't hurt every single time it goes in. Because the dagger that goes in is kind of big. It's bigger than an 18 gauge, it's huge. And so an 18 gauge is pretty big, and it hurts. So if you don't have that Emla cream on it, it's going to be painful when they put it in. And the port isn't very big. It's, I want to say like, whoops, where's my camera? There it is. Whoop. It's about that big, just under the skin. It never bothered me at all. I was happy to get rid of it, which I did do. I did get rid of it eventually. But it's something that helped me so that they could take blood work out of it. They could give me the medications through it. I was able to have fluids at home through it when I was going through chemotherapy. So it made my life a little bit easier that way by having it. Like I said, a couple of years after I was finished everything, I decided to remove it. Some people keep theirs, and I needed, in my mind, I needed to have it finished, so I decided get rid of it. And so those little things, some people get PICC lines, and that goes in their arm into the vein, and they get the PICC lines. And it just, again, it depends on what your treatment is, whether you have those options. Some people just have IV every time. Some people have bottles if you're men for like colon cancers, things like that. So there's all these different things to try and make things a little bit more comfortable. So I was finished. So I kept my portacath in. I had to take the Herceptin for a year. And Herceptin didn't have a lot of major side effects for me. I actually breezed through that part of it. I started to feel a little bit more normal. But one of the other drugs I had to take through my chemo treatment was, it was called Neulasta, which was an injection once a chemo treatment, basically. And what it did was it regenerated my cells, my white blood cells in that, because I actually was dipping very low. And when your white blood cells get very low, your body has trouble fighting off infection. So after my first round, I went, so actually my second round was a bit delayed because of the fact that this was what happened to me. So the Neulasta was a drug that I took to help boost that up so that you have an immune system so that you can continue taking the chemo treatments and your blood levels will stay pretty stable and that your body will fight off infection, Lord forbid, if that ever happens. It's a pretty dangerous thing when you're going through chemotherapy to get an infection. So you have to be very careful about who you're around. Nobody can be around you if you're ill. If they're ill, not you, but if they're ill, washing hands, cleanliness, things like that, because you don't want to get an infection while you're going through chemotherapy because that could kill you. Like it really could, because your levels are so low, right, on sometimes. So the Neulasta helped. The thing about it is when you take Neulasta, honest to God, you need painkillers. You gotta don't even be shy because the pain, because you can feel it in your bones, because that's where everything generates, right? And you can feel it in your bones and it's very painful. So they gave me some painkillers for that. So I did that through all 6 rounds of chemo. I didn't need to take Neulasta after the chemo was done. Obviously, the Herceptin does not affect your blood cells the same way that chemotherapy does. So one of the things was, before I was diagnosed with with cancer. I was talking about chemo for so much, I had that in my brain. When I was diagnosed with cancer, I was running. I was a long distance runner. I was training for, my goal was to do a half marathon. So I had started training for that to see if I could do it, so I had all these goals. And when I was diagnosed, I said, okay, I'm going to still run. I'm going to keep running. Well, that quickly stopped around round 3 because people were walking faster than I was running. And I decided, I think I need to stop. I think I need to stop that. So I actually stopped running at round 3. So after my chemotherapy was done and I started getting back to feeling like myself, because it took a lot, chemo took a lot out of me. It took, I was always very tired, very drained. Um, the one thing I wanted to be was well enough for my kids as well as I could be. So they would go off to school and I would lay down. They would come home from school and I would make sure I got up and I made sure that I could help them. The first day after chemo was generally not great, but I tried to make sure that I got up and did what I need to do to be present for them because they were only 10 at the time. So they were still very little. Oh, thank you, Caroline. Love that you're explaining your entire journey through this. So important and inspiring. Thank you very much. I hope it does inspire somebody and give somebody hope that there is life after a cancer diagnosis and cancer journey. Yeah, my kids were only 10 and they were so little. And, you know, I needed to give them hope as well as myself that I could get up and do this. I could get up and still function during the day, function and do things as normal as I could at the time. So after I was done all my cancer chemo, I decided, okay, I'm going to start running again. So I put my shoes on, I started running again, and man, it hurt. That Neulasta drug did a number on my bones and my joints, and I was in so much pain. And I was sad. I was very sad because it hurt so much that I didn't want to do it. And because before I was so physically active before my cancer journey, this was important to me. And so my goal was to do a 5K. I wanted to be in the CIBC Run for the Cure, the 5K that happens in October. And I was determined to do that 5K. And I did it, but it hurt. I was happy I did it though, because it proved to me I could get back to being me again. Because I was desperately searching for what that was. I was desperately searching for who that person was. Even today, I have trouble looking at pictures of what I looked like pre-cancer, because it's almost like I've marked that moment in time. Oh, that picture was before cancer. This is after. And it took me a very long time to go through that transition of not thinking that way. This is cancer before, this is cancer after. This is me before, this is me after. And I look at my kids' pictures that way too. Oh, this was before they found out their world. You know, that moment in time, you know, they talk about that moment in time that changes your life forever. That was their moment in time. I changed their life forever. And I remember when my son was growing and, you know, boys change, grow, develop. He found a little, absolutely normal, little lump in his chest. And it turned out to be just a little, you know, pimple or something. But he got so scared because he thought, Mom, what if this is happening to me? What if this is, you know, what if I get breast cancer? Because he knows men can pass down the breast cancer gene, and men can get breast cancer too. That is a thing, right? That is real. And he knew that. And so he was like, oh my goodness, what if this is happening to me? And that completely scared him. And it made me realize the deep effect that this journey, my journey, had on them. And I'm very cognizant, aware. And so when they come to me with issues with their health and they're scared, it's just important to embrace that with them and get, you know, talk it out. And then if it makes them feel better, in Matt's case, we took him to the doctor. The doctor said, no, this is perfectly normal. That took the weight off him, if that's what you have to do. But you can't dismiss their feelings because they're real to them. Those feelings are real. And so you can never dismiss them. You just validate them and you support them in the best way you know how. And that way they feel like they've been heard and that their feelings are valid. So that's kind of how I have approached them. Did we tell our kids a lot? Some people say, well, their kids were so young. Did you tell them everything that was going on? I didn't tell them everything. because you know what, it was hard enough for me to go through it, and my husband to sit there every week, every time I went for chemo, and watch me go through it. They didn't need to know everything. But was I honest with them about, they knew when I was going to have surgery, they knew it was cancer. Those things were very real and very, very important that they knew. I wasn't going to lie to them, and I wasn't going to say, no, mommy's going to be fine, because I really didn't know if I was going to be fine. When I got all the pathology and all the treatment and every decision I made with my husband through this whole thing, I knew that I had a very good chance of survival, and that gave me hope. But I couldn't say I'm completely cured until, you know, now 9 years later, almost 10 years, it'll be 10 in the fall, that yes, now I can say, oh yeah, I'm completely cured. I'm completely fine now. It also changes, going through a cancer journey like that also changes your mind. So for me, I look at life differently. That was a profound change in me. I look at life differently. I don't like to wait for things. So for example, if I want to go on a trip, right now I can't go anywhere, but in times before COVID, if I wanted to go on a trip, I would just go. I'd be like, okay, Don, this is what we're doing. This is where we're going. And he'd be like, oh my God, she's doing it again. Or, you know, I decided when I wanted to be an RNFA, I decided, well, what am I waiting for exactly? So I went and did it, and I became an RNFA. And so those are things that I found in my mindset has changed, because I'm like, what am I waiting for? Right? And it's something innate in all of people that have gone and have faced this mortality in their life, is that thing. We all have that in common. When you're faced with your mortality, especially at young ages, you realize how precious life really is. And I know that sounds completely cliche, and you're probably thinking, oh my God, right? But it's true, right? And we only have one kick at the can. And I know my dad's behind me. He's making his lunch. I'm looking after my dad today. This is what's happening. This is why I'm in a different locale. He's taken care of. He's good. So, and like I said, I know it sounds very cliche and very, but it's so true. And it makes you think about death. It makes you think about what you want out of this life. And it makes you think about how you want to get there and do what you can, no matter how long or short your time is. Because we don't know. We don't know how long or short your, life is. So I think it's very important to keep those things in perspective. Let's see, Nita, I was absurdly happy. I can't even talk today. Last month at my last checkup, a couple of weeks before the 1-year anniversary of my surgery, and the doctor said I was 1 year cancer free. Yay! High five. That's awesome, Nita. I am so happy for you. It's the best feeling in the world when you can be told those words. It's the best feeling in the world. And I remember after my 5-year checkup, and my doctor said to me, she said, go live your life. It was like a weight went, and I felt like I could breathe. I didn't realize until that moment how much I had been holding my breath, that someone said to me, go live your life. Not that I was holding back, but it's just that realization that you have a second chance at going forward and living life and doing the things you want to do within reason. Don't get carried away. Right? Because we still have things, we still have kids, we still have husbands, we still have those jobs, blah, blah, blah. We still have all those things that we have to do, but go live your life. So yeah, so that's pretty much how I've been trying to live my life. Obviously, life throws shit at you. It always throws shit at you. And that's just part of it. It isn't always going to be happy, roses, sunshine, blah, 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 right? Life throws things at you. And this was one of those things that life threw at me. And I am happy to say I'm like I said, almost 10 years cancer free and living my life. And I hope that this chit chat today gave some people some hope to know that there is life on the other side, to know that there are people that have survived what it is that you're going through or your family members are going through right now. And like I said, some people, their journey is very different and the end is not the same as mine. And that happened to my mom. She had lung cancer. She passed away almost 2 years ago. It'll be 2 years in June that she's passed away. And her journey was very different. But we took steps to help her make that transition in the best way we knew how, and the best way to give her dignity and to give her the best possible outcome that we could. And that's sometimes all that you can do as a family member. And it was amazing how at peace my mom was at the end. And she had done a lot of soul searching to get to that place. And we were lucky enough and privileged enough to be able to help her do that journey. She ended up using the MAID program, which is a whole other topic, which maybe we should talk about that one day. I'll put that on my list. And that is medical assisted in dying. So she had medical help to pass. For her, that was the best decision to make. It was on her terms. And everyone's different in their thinking in that way, but we'll have another what has changed your life on that one, because that one is definitely an interesting topic. Anyway, so back to this. I hope that this has given you hope and given you a little bit of insight into my breast cancer journey and where I've been, where I've come from, and my journey of where I'm going and living life and trying to do the best life I can with the tools that I have. And I hope you guys have a fantastic Sunday. Enjoy the day. It looks like a beautiful day out there. And thank you for watching What Has Changed Your Life. Thank you for joining just me. And we'll see you next time. Have a great day, everybody. Be kind, stay safe, choose joy. Bye.